Companies provide health benefits to ensure the well-being of their employees and their families. When we talk about benefits for the LGBT workforce, we are not providing special benefits, but extending the same benefits that are being provided to the rest of the workforce and including the LGBT population that was excluded earlier. In this edition of Diversity Dialogues, we're talking about inclusive benefits. Firstly, we need to include same-gender partners of LGBT plus employees. Secondly, we need to cover gender affirmation surgery that transgender employees go through. Thirdly, we provide HIV care and treatment for all employees. It is important not to dwell on the number of people that will come up and take these benefits, but the fact that the company is being inclusive and providing equal benefits to everyone is more important. It is good to start the conversation with your existing insurance vendor, and of course your leadership has to be fully committed. They would echo this message to the compensation and benefits team, who will in turn take this to the insurer and include this in the contract. In the first approach, the insurer would be bought in to make this happen, and they would offer to cover same-gender partners of LGBT employees in the same exact policy that is covering heterosexual married couples today. Similarly, they would cover gender affirmation surgery and procedures apart from all the ailments that are being covered today. This is the most equitable option. If your insurer is not fully bought in, there is an alternate method. The insurer could choose to cover same-gender partners as separate individuals in an alternate policy with similar benefits. In the third approach, there is always a reimbursement option available when the company does not want to get into details. What happens here is the same gender partner of the employee goes to the retail market and picks up any insurance plan, and the company reimburses the employee for that. Similarly, the company reimburses a transgender employee for the gender affirmation surgery that they underwent. Companies have used creative ways in the group insurance to provide this coverage as well. What matters is the intent to make this happen using whichever method possible. Now, the first part is to come up with a methodology, right? And the second part is to actually develop the process how employees will come and enroll for these benefits. There are some questions that need to be answered by companies before coming up with this process. Should an employee have to self-identify as LGBT to take this benefit? What details of their same-gender partners is being collected? How do you even verify such a claim? Who handles this data internally and externally? How is this data stored confidentially? If it's a transgender employee, what medical documents are we asking for their gender affirmation surgery? Now, let's say there is an employee who has a legally married spouse and is still coming up to avail this benefit. Are we going to allow it? It is important to keep the process simple and uncomplicated for employees to come forth and avail it. Having this equal benefit is a visible sign that your company is being inclusive. And when employees come forward and avail this, it is a proof that your inclusion strategy is working. Thank you for watching this video, and please reach out to us if you have any questions.